Good afternoon. My name is Claire Spolton-Dean. I'm delighted to present to you the Torbay hip score, a novel grading system to determine complexity in primary hip arthroplasty. I'd like to take this opportunity to thank my co-authors and in particular the senior supervising consultant, Mr. Ramesh. Total hip replacement is the most common joint replacement procedure performed globally and typically has a very high patient satisfaction outcome. However, we as surgeons know that multiple factors influence the outcome, whether they're related to the patient, the surgeon, the implant, or the perioperative process. Despite this element of complexity, the success or failure of a total hip replacement is ultimately ascribed to the operating surgeon. With the introduction of our scoring system, we highlight that not all total hip replacement cases are comparable, and that certain factors cannot be changed, such as bony anatomy, which may significantly influence the outcome, and therefore postulate that the introduction of a classification system to ascribe complexity would be a worthwhile and valid piece of research. In order to develop our score, we started with performing a literature review to see if there was any evidence on whether a hip could be defined as complex, simple or intermediate, and see if any validated scores regarding this existed. No significant evidence to this end was found. We then went on to perform departmental discussion to subdivide a total hip arthroplasty into the key areas that we felt influenced complexity. We were able to divide this into 5 key areas, namely the acetabulum, the femoral neck, the femoral shaft, local factors such as the presence of a previous implant, and specific patient factors such as elevated BMI. We were then able to look at these in order to create a simple scoring system that could be applied. We decided on what was to be included in each subcategory and came up with a total of 20 points that were to be looked at. An initial pilot study was performed looking at 20 complex cases on the current waiting list for total hip replacement. 12 individuals of varying seniority reviewed the images, and based on the results of this, we determined the weightage of scores of each category and the grade boundaries for simple, intermediate, and complex total hip replacement were set. We then went on to look at 30 patients of any complexity chosen from the current hospital waiting list, and the scoring system was applied by 6 raters, 4 consultants, 3 of which were specialist hip surgeons, and 2 specialist registrars. Following this, we went on and performed inter and intra observer reliability. Our scoring system showed 100% correlation in identification of a complex total hip replacement. We used a Fleece Kappa coefficient for inter-observer reliability, which showed that there was overall a good reliability, and it became better the more senior individual who used it, and particularly there was excellent inter-observer reliability between the hip arthroplasty specialist consultants. The scoring system that we have developed is a quick, cheap and reproducible system that doesn't require any additional imaging or equipment to be used. There's no length in training and can be done by anyone, including in the outpatient setting. In the future, we hope to develop an app which could be utilised on a day-to-day basis by any clinician. In conclusion, we believe that a validated complexity scoring system for total hip arthroplasty would allow multiple different benefits to both the patient, the surgeon and the management team, as listed below. We strongly believe that our work is a useful basis, but is by no means the final product. It is definitely underpowered and needs further refinement before it can be a useful day-to-day system. And we hope to present this work shortly.